So first of all, thanks to all of you. Everybody who works on this project is critically important. And it's great to see so many people joining us, and your work in the hospitals is extraordinary. And just a shout out to Gwen, who was with us in the National Children's Study from the very beginning, and Jean, of course, as well, too. So I thought I would give you a picture of developmental disabilities and also emphasize especially how we can prevent them, which is sometimes forgotten when we talk about neurodevelopmental disabilities. So the next slide. So first of all, what are the neurodevelopmental disabilities? Now, I'm going to list 6 of them, really central. 3 or 4 of them are quite uncommon, and then 2 are really fairly common in the population. So intellectual disability, which is usually defined by an IQ score, although what we really mean by that is the inability to perform some of the tasks that require intellectual skills, reading, writing, calculating, and so forth. Severe intellectual disability is quite rare, 3 or 4 per thousand live births. That includes a lot of chromosomal abnormalities. They're very often people with severe intellectual disability often have evidence of other disturbances of body function. Mild intellectual disability is a whole lot commoner, and quite a bit of it is due to social and economic circumstances, to be perfectly honest, although some of it comes from other problems. Autism spectrum disorders we hear a lot about. Now, apparently, as many as 1 to 1.5% of children now carry that diagnostic label. One has to understand that the diagnostic spectrum of autism spectrum has been enlarging in recent years. It's not quite what it used to be. A lot of people are included who used to not be in there. There's been some shift of people with intellectual disability who also have behavioral problems into the autism column, and that's been shown. So it's a little bit iffy as to exactly how many have that number, but certainly it's not that rare. And I've had a particular interest many years in cerebral palsy. This is the motor deficit. It's often linked with other disabilities. It occurs in about 2 to 3 per thousand population. I've given you the large range there. And it's important because it's the most important motor dysfunction that we see in children. And then the 2 that are quite common, attention deficit hyperactivity, is diagnosed in 5 to 7% of the population. That's quite large, and that interferes with learning. And then learning disabilities, by which we mean people who have trouble in school, even though they seem to have a completely normal intelligence quotient. So there's something about their ability to acquire learning, and there are specific forms of it: dyslexia, difficulty with reading, acalculia, difficulty with calculations. So, and all of these need special attention. So if you allow the overlap and look at the total, it's like 1 in 6 people in the United States has one form or another of the developmental disabilities. They're quite important. Some are quite severe, and we definitely want to invest in preventing them. Next slide, please. So it turns out, I'll tell you about 8 ways to prevent developmental disabilities, and a lot of them involve pregnancy. And I think I actually left out 1 or 2, but this is probably sufficient just as a starting point. Next slide. So I'm going to talk to you about 2 interventions that help reduce developmental disabilities before pregnancy, 2 in pregnancy. Next, 1 in labor, 2 immediately after birth, and 1 in childhood. Next slide. So here they all are. Before pregnancy, immunization against rubella is very important, and having women take their folic acid before they get pregnant is also very important. I'll elaborate on each one of these. There'll be a slide on each one of these. During pregnancy, prenatal screening is an ability to detect chromosomal abnormalities, tube defects, and other kinds of problems. And as Jean Kerber has told you, iodine deficiency is something we worry about. We'd like to make sure that everybody gets a proper iodine intake in pregnancy. During labor, we have now discovered that the cerebral palsy in births under 32 weeks, preemies, if magnesium sulfate is administered in labor, can reduce the risk by about 30–40%. At birth, of course, you know about newborn genetic screening, and some of the things we screen for can cause developmental disabilities, especially PKU, which causes intellectual disability, as does hypothyroidism. So it's very useful in preventing disabilities to be able to screen babies at birth and supplement them with whatever is missing, be it phenylalanine-free diet or thyroid hormone. Less well known, perhaps, is another mode of reducing the risk of cerebral palsy, but this not in preemies, but in term babies who had very severe birth asphyxia. In fact, if you reduce the body temperature by 2 degrees Celsius for 3 days, you actually reduce the risk of cerebral palsy. And then in early childhood, there have been randomized trials of enhanced early education that have shown improved school and cognitive performance in children. And that particularly targets mild intellectual disability. Next slide. So I'll take these into a little bit more detail. Rubella immunization, the congenital rubella syndrome, which I'm sure none of you have seen, but I have seen, is characterized by, among other things, microcephaly, a small head, intellectual disability, very rarely cerebral palsy, but it is seen. Hearing and vision loss. In fact, this first, the discovery that rubella caused malformations was first worked out by an ophthalmologist who saw all sorts of babies being born with congenital cataract, and he linked it to an outbreak of German measles in the community when the mothers were pregnant. And you can also have cardiac and pulmonary abnormalities. That's why every woman should enter pregnancy with antibodies to rubella, either because she had rubella or because she was immunized against rubella. And you have to do that before she's pregnant. It's no use discovering that when she's pregnant, that she has no immunity to rubella. Folic acid has to be given before pregnancy start because the neural tube closes as a type 1 17 to 30 days after conception. And so by the time the mother knows she's pregnant, already the opportunity to prevent the neural tube defect is not there. And this, believe it or not, it can reduce the risk of neural tube defects by as much as 2/3. It's quite astonishing how helpful that is. And these children with neural tube defects, in addition to having sometimes paralysis below the waist, about 10% have cerebral palsy, and maybe 1 in 5 have intellectual disability. And also we've discovered later that folic acid supplementation may also prevent autism. It's a little less secure, but there are some studies suggesting that. Next slide. Now let's turn to pregnancy. I think you have to hit something else to get the text. Yes. The little child on the right is from Papua New Guinea, and this is what this child has is endemic neurologic cretinism. The baby has cerebral palsy, has hearing loss, intellectual disability, esotropia, and eye problems. This is when iodine is really, really deficient, and the baby does not get enough thyroid hormone from his mother to develop intellectually. We don't have that here in the United States, but we do worry that even, for example, as Jean has told you, about 1/4 of our Lansing area women seem to have a little low on the iodine, and we hope this doesn't cause intellectual problems, but it's important to keep the iodine levels up, and not every prenatal vitamin contains iodine, as I'm sure you've been told by Jean. And then the other thing we do in pregnancy, of course, is prenatal screening, and we try to detect chromosomal abnormalities, and also you can detect neural tube defects if they weren't prevented by folic acid, and other conditions that can lead to disabilities. Next slide. There is this intervention in labor. I remember being very skeptical about this, although our own studies did in fact show that women who took magnesium sulfate their babies had less CP if the baby were preemie, but now there have been really proper randomized trials, and it probably reduces the risk of CP by about 1/3 if the mother gets 2 IV doses of magnesium sulfate in labor, if she's in labor prior to 32 weeks and the baby is delivered. And, mag sulfate is not the best of all medicines. If you ever had to take it, it doesn't make you feel so great, but there is this benefit, and probably the mechanism of action is probably very well established, that magnesium sulfate blocks certain receptors in the brain that are damaged by the asphyxial process or perhaps also inflammatory processes. Next bullet point, or next slide. So the 2 interventions at birth, okay? The first one is head or body cooling. Again, this is one area where recent randomized trials have really made a great contribution. And it's amazing how consistent the trials are. There's about a 1/4 reduction in cerebral palsy in those babies who had really awful labor and delivery and came out with very low APGAR scores and began to have seizures and such. The real whole full-blown neonatal encephalopathy with birth asphyxia. This is reserved for term-born infants. The preemies don't do well with head or body cooling. And you lower the body temperature by 2 degrees centigrade for 72 hours, starting right away within 6 hours of birth. And this is really, it also, by the way, reduces mortality too by about the same amount. Next bullet point. And then, of course, newborn genetic screening, phenylalanine. Phenylketonuria is the disease. It's a disease where babies, for some reason, don't metabolize phenylalanine because of a genetic defect. And phenylalanine is toxic to the developing brain. So, but if you put the babies on a phenylalanine-free diet, then the babies grow up normally. Isn't that wonderful? And they don't get it in utero because the mothers metabolize the phenylalanine for them. Also, congenital hypothyroidism, again, the same situation in utero. The mother has a good thyroid, so the baby doesn't suffer. But babies born without a thyroid gland or with an abnormal thyroid gland, if they're thyroid deficient, if you don't treat them with thyroid hormone quickly, they will have intellectual disability. Next slide. And then just to turn to something a little bit outside the range of what you guys do in pregnancy, it is the fact that if you put together most of the studies that have looked at especially the high quality studies, so look at special early education between age 3 and 5, it does raise IQ, and they're pretty substantial effects. More than half a standard deviation. And this fades a little bit with age, but you still see it after age 10. And actually they know that even in adolescent years, you see some beneficial effects of early education in school. So next slide. So to summarize, it's been a quick round trip around all these issues. We do have a lot of opportunities to prevent developmental disabilities. And the time to intervene can be prior to pregnancy, during pregnancy, at birth, right after birth, in early childhood. And so healthcare providers and people who see women who are contemplating pregnancy or are pregnant, I just want you to know that there are opportunities to reduce the frequency of developmental disabilities. So thanks very much.